Unilateral neglect. Objectives of this presentation. Objectives of this presentation will be to define what unilateral neglect is, inform viewers about the causes of unilateral neglect, inform viewers about the treatment information for unilateral neglect, inform viewers about the signs and disorders, provide information on the outlook of recovery. What is unilateral neglect? It is a deficit in attention to and awareness of one side of the patient's body. Unilateral neglect can vary in severity and senses affected. Signs of unilateral neglect: acting oblivious to one side of the body, inability to see objects on one side of the body, eating food from one side of the plate only, and dressing and grooming only one side of the body. What causes unilateral neglect? The most common cause of unilateral neglect is damage to the right hemisphere, most commonly caused by a stroke. Other disorders that can cause neglect is brain cancer and traumatic brain injuries. It is important to note that up to 2/3 of patients who suffer from acute strokes show signs of neglect. Techniques to improve unilateral neglect. Approach patient on affected side. Place objects on affected side to make patient search for them. Use tactile methods to make patient aware of affected side. Safety precautions of unilateral neglect. Visual precautions. In some cases, patients may be unaware of one side of their body. This will impair their ability to see dangers on one side of their body. In other cases, a patient will only be able to see out of part of their eye. This is called hemianopsia. Sensory precautions. In some cases, patients will not be able to feel sensations on one side of their body. This can cause them to injure, burn, or inflict some other type of damage without knowing. Perceptual precautions. A patient with impaired judgment might lead them to place themselves into dangerous situations due to an impaired ability to make sense of their surroundings. How to screen for unilateral neglect. The screening methods are similar to the signs, however, it will be identified by an occupational therapist or other healthcare professional. The healthcare professional asks the patient to perform the following tasks. Drawing a clock. The professional must note if the patient neglects to draw the numbers on one side of the clock. Have a patient read a paragraph from a book. The professional needs to note whether the patient starts in the middle of the paragraph. And observe the patient while eating. Note if the patient only eats food from one side of the plate. If the patient did any of the listed above, they are positive for unilateral neglect. Here's a demonstration video of a person simulating the signs of unilateral neglect.
The patient being observed is suffering from unilateral neglect. Unilateral neglect, or sometimes called spatial neglect, is defined as the inability of a person to process and perceive stimuli on one side of the body or environment, where that inability is not due to the lack of sensation. As you can see, the client is unable to draw a complete circle, or flower, which we are going to have her draw next. Patients who suffer from this condition will not be able to cross midline. The reason for the neglect of one side of the body is due to damage of one of the hemispheres. In most cases, the effect will manifest on the contralateral side of the damaged hemisphere, but in rare instances, the unilateral neglect will manifest on the ipsilateral side of the damaged hemisphere. So as you can see, she was able to draw half the clock and up to 6 o'clock. Now we're going to have her continue with drawing a flower. So go ahead and draw a daisy for me. And as you can see, she was also able to only draw half of the flower. And that is what you can see manifest on patients with unilateral neglect.
Recovery. Patients with neglect will often show some improvement as they receive intense therapy and learn compensatory methods. It is important to note that the right hemisphere is better able to compensate for loss of function of the left hemisphere. This is because the right hemisphere is specialized in spatial perception and memory. Another thing to note in the recovery stages is that patient education is a must. A therapist will only spend a limited amount of time with the patient and needs to educate both the patient and the family to have the best recovery possible.